everyone, Ellen here, just giving you a quick recap on use of a rubber dam. Here's some of the equipment that you will need. Obviously you won't need 3 different types of clamp, it depends on which tooth you're going to use, you're going to isolate. Here we've got a rubber dam frame, the rubber dam itself. Some of them have got nice stamps on them that mark out each of the teeth. You don't have to have that stamp, but that can be nice. We've got some floss, as it is best practice to thread some floss through the rubber dam clamp before you place the clamp on. That, in the unlikely event of the clamp breaking, it won't go flying off in all directions, and also it creates a nice challenge for your dental assistant when they're sterilising it in the sterilising room, because they have to cut it off. We've also got the clamp forceps, or putteronerers as I call them, the rubber dam punch, and scissors are usually helpful as well. So I'll just show you these clamps in a little more detail. This is what a molar clamp looks like. You can see that the wings are a little bit bigger. This is what an anterior clamp looks like, so that's for a front lower tooth. We don't use that that often. And this is what a premolar clamp looks like. So the ones that we probably use the most is this molar clamp. First of all, before your patient arrives, what you want to do is you want to have your rubber dam semi-set, ready to go. You'll probably know which tooth you're isolating, so you'll be able to have your clamp all ready. And what you do is you get a nice big piece of floss. I'm going to get another piece because that one was a bit short. Let's say we're doing a molar today. You're going to thread your floss through, and it is best practice to do this, although that your assistant, as I said, will probably be a bit cross with you when they're trying to get it off. But it is best practice to tie floss and just loop it around a few times before you start, just for safety. And then if you've got a little bit of a length, that's also a good idea. There we go. And obviously that comes off when it goes into the sterilizer, but that clamp is ready to rock and roll. The other thing that is a good idea too is if you've got your rubber dam pre-punched. What I like to do is, if it's a single tooth, I like to go to the largest size on the rubber dam puncher, hole puncher. There we go. And place the hole nearish the middle. Usually I'll do 3 beside each other, just to give it a little bit more room, especially if it's a permanent molar tooth. For a deciduous tooth, you don't need to. You can isolate more than 1 tooth at once, but that's a nice sized hole for a single tooth. If you wanted more teeth in a row, you can punch them further along, so if you're doing them side by side. Now, another thing that I find it's quite useful sometimes is if you cut off the corner of the rubber dam, you've then got a nice little piece of rubber dam to use as like a wedge if you're having trouble keeping the rubber dam down on the other side of the clamp, or if you've got multiple teeth. So sometimes I'll cut little corner pieces off just to use as spare. But that's basically the prep that you need to have done before you see the patient. And in part 2, I will show you how to place the rubber dam. Thank you for watching.